Welcome back. We're talking about something very important today. Breast cancer is the most common cancer in women. With Breast Cancer Awareness Month just around the corner, we're taking a moment to explore ways women can take charge of their diagnosis and foster a strong body through treatment and, of course, beyond. For that, we welcome now a breast oncologist with IU Health Simon Cancer Center, Dr. Tara Ballinger. She has a look specifically at how diet and exercise can play a role in decreasing the rate of occurrence in breast cancer patients. Thank you for your time, doctor.
Thanks for having me.
So let's go ahead and dive right in here. We understand weight gain is common after breast cancer diagnosis. It poses a threat to survival and impacts the rate of recurrence. Why does that happen?
Breast cancer treatment, unfortunately, the chemotherapies that we give, some of the medications that can alter hormones actually cause women to gain weight. And as you mentioned, weight gain after diagnosis is associated with increased rates of recurrence. But on the flip side of that, then after diagnosis, you have this opportunity to make changes that are ultimately going to impact outcomes. What we see is it's less about body weight and more about the composition of that weight, the fat and muscle. Fat tissue is actually pro-inflammatory. It alters your body's immune system's ability to control cancer. It alters metabolism pathways that can create cancer and actually makes hormones that can facilitate breast cancer progression.
Okay, we'll stick with the weight because trying to manage healthy body weight is very critical. Let's talk exercise. What works best there?
Yeah, really ultimately any exercise is good. Any exercise is better than no exercise. Exercise can help maintain your energy balance so you can maintain a healthy weight. But even in the absence of weight loss, exercise is associated with a lower risk of getting breast cancer and then improved outcomes after breast cancer, better survival, better treatment tolerability. The best exercise regimens combine aerobic exercise, so getting your heart rate up, and resistance exercise so that you can build muscle and actually change that body composition. The specific type of exercise depends on who you are, what your preferences are. It's best to start slowly, gradually increase. The goal is 150 minutes a week of moderate intensity exercise. So that's exercise that's getting you winded, which is different for every person.
Okay, you're very knowledgeable on this, which is why we certainly appreciate having you in. Diet is a powerhouse when it comes to health. We've highlighted, of course, in months prior, the positive and prolonged impact eating well can have on patients, everybody. How should patients approach their diet in these type of circumstances?
Yeah, and I appreciate you guys focusing on these healthy lifestyle habits that I think really empower people to take control of their health. In terms of breast cancer, there's no specific diet that's best. It's important to know you don't need to be restrictive. Leaving out soy or sugar to control cancer, those things are myths. Ultimately, what we see is diets higher in whole foods, less processed foods, more vegetables, less saturated fat and red meat. Those diets are associated with improved cancer outcomes. But really, ultimately, I think the best diet is the diet that's going to help you maintain your body weight the best. Okay.
A load of information there, a whole plethora. We certainly appreciate it.
Yeah, my
Dr.
pleasure.
Ballinger, thank you so much for being here today.